Hi, this is Dr. Chang again with another patient update from Hanabusa IVF. This is a case of a woman with 7 years of miscarriages. So Ms.P came to us, actually it's very recent, within the last year, 45 years old. She's been pregnant multiple times. 6 times she's been pregnant. She had an ultrasound that confirmed a miscarriage. There was no heartbeat. She's been pregnant multiple times, multiple chemical pregnancies where positive pregnancy tests never made it to the ultrasound. She was at an IVF center 3-4 years ago, and they did multiple IVFs, created multiple blastocysts. Unfortunately, none of those blastocysts were tested normal, so she could never do an embryo transfer to eliminate the possibility that the miscarriage is from a chromosomally abnormal embryo. Recently, before coming to us in the last year, at another IVF center, she did 3 more IVFs where she did fresh day 3 embryo transfers. She got pregnant. She once again miscarried every time. Now, looking at this case, it's, everybody's going to look at her age and say, look, it's probably an abnormal embryo and that's why you're miscarrying. But statistically, it's very unusual to miscarry 2 or 3 times in a row of abnormal babies. Statistically, there's bound to have a normal embryo that's going to come about. With this in mind, I'm thinking to myself, hey, look, this woman has a embryo rejection issue. Her immune system for some reason is reacting and overreacting. The body normally adapts to an embryo. The embryo is not 100%. Normally when a person is exposed to something that is not completely identical, their body's immune system immediately attacks it. Organ transplants, even if the match is close to perfect, these patients are on boatloads of medications to suppress the immune system to prevent that rejection. In the case of a pregnancy, 50% of this embryo is not the patient, it's the partner. So in a situation like that, the body does adapt, but in some cases, the body doesn't adapt well. And well, this is my theory. And in this case, the body is attacking despite the fact that it's supposed to be adapting. Now, very similar to an organ transplant, how do we allow the body to adapt? We try to, number one, suppress the immune system. Typically, I like to use steroids, although there's other boatload of medications that are available. And the other thing is to prevent the blood clots the body is trying to create blood clots to wall off this foreign body. So what we need to do is prevent the blood from thickening so it's not to prevent all the nutrients reaching this baby. So recently, Ms.P contacted us and said she was pregnant. And we confirmed that pregnancy. The hormones looked good. So we immediately started her on this cocktail of blood thinners and steroids. And the pregnancy continued. And just last week, she and her husband were able to see the first fetal heartbeat in 7 years. The moral to the story is that all the doctors up to this particular point was blaming the patient's age. There was multiple testing that suggests, look, the patient doesn't have any other problems there. But from a clinical perspective, there's an issue. Someone does not miscarry 6+ times without having some sort of issue going on. And in a case like that, you can't not do anything. You have to try something as long as the risks are limited. In this particular situation, we found with a medication, even though there are tiny risks with these medication, the benefits far outweigh the risk. And in this case, the benefit was the first heartbeat in 7 years.